What up, you guys? Before we even get started, um, if you're new to my channel, I encourage you to subscribe, like the content, and yeah, also comment what you think, any questions, any suggestions for future YouTube videos. But as the title says, man, there is a harsh truth about nursing that that a lot of people don't talk about. Um, don't let this I'm going to tell you the truth because I feel I have to tell the truth, but don't let that discourage you from pursuing the career. I'm going to make other videos, and I might have posted other videos in relation to the topic and to the career. Encouraging people to do so, meaning like choose a career and the benefits of doing so. But I always feel that you got to give the pros and the cons. You got to talk about the good as well as the bad because you want people to be prepared for what they get themselves into, especially if you promote it. Yeah, you just want awareness, man. And with that said, there's a lot of harsh truth about nursing, man, about being a nurse. Especially a registered nurse, whether you just have your RN, BSN, and you're on that medical floor, whether it's med surge, telemetry, ICU, CCU, SCU, whatever, ER nurse, whatever, man. Uh, NICU, but right now we're talking, highlighting the floor nurses. So of course, like just to tell a little bit about the good of nursing, right? And I have other videos, and I will make other videos where I expand on this, and I'll talk a little more about the benefits of being a nurse and pursuing the education to become a nurse, the benefits of it. But just to rub before I go talk about the harsh things about the nurse. Let me talk about the benefit of it really quick. Um, it is, in this economy where there's a lot of careers that promised a good, bright future. Um, Nursing is the only career where there is uh, huge suspected job growth. Like meaning when you graduate, it's a very high percentage chance that you're going to find employment, and not only that, but there is going to be a lot of options. There are a lot of options in the field when you do finish. So if you are pursuing that career, whether you get your associates, get your bachelor's or more, I truly believe that you're going to find employment. And not only that, I think you're going to be valuable, especially if you have like your California license, US license. You could toy with the idea of, going to like a different country, Canada. There are a lot of like nurses from the Philippines that, they started as doctors in the Philippines. And because the nurse profession is so sought after here in America, especially California. People come from different countries. They have like doctoral degrees, and they pursue, being a registered nurse out here. And it's because it's one of those. I'm not gonna say guaranteed careers, but it's one of those high uh, job growth careers, as I said. The pay, it isn't as much as, this is kind of like touching on like not the harsh, but it isn't as much as people think it is. But it's not like you're going to be like broke being a nurse. It's you'll be stable. You'll be like middle class stable. um yeah, you'll be stable, but you're not going to come close to making to what like a doctor or a surgeon making. A lot of like family members, especially if you come from like a poor family household, which I did. They're going to mistake the career for being like this. You're just going to be like a baller, like immediately. And you could save everybody. That's not the case. You're going to be able to be stable for yourself, but depending on how far you go, the extra education training you do, even that's a risk. um, how much experience you gain, what particular area you work in, that's going to determine your pay range. But typically, your first to third year, you're like first to fifth year, I would say you're going to be kind of like stable. You're not going to be like balling like that unless you're like one of the ones that get those extra promotions and negotiate a really good contract. And you also consider like um, if there's kids, like if you got kids, you gotta financially provide for your kids, I imagine. And it's a lot of people that do have to pick up extra shifts, even as a nurse, because it doesn't pay like on a regular. What we do 12-hour shifts 3 days a week. The regular pay without picking up overtime, especially in California, is kind of difficult to maintain a life with kids, especially if it's multiple kids. So a lot of people would pick up extra shifts that have kids. Another one of the harsh things is that when you pick up those extra shifts, and especially if you have kids, but even if you don't, um, a lot of the nurses get burnt out. The nurses, especially like the med surge, ER, or any like on the floor nursing field and profession, it's a high rate of burnout. And a lot of people, the rate that's included is the ones that talk, but it's a lot of people that stay silent and have burnout. So I would say it's probably like more than 95% of the people that I've interacted with that are nurses are burnt out. And what it does is it increases your um, chances of over consuming like alcohol. Some people get in trouble, like we handle narcotics, so a lot of nurses have gotten caught or in trouble doing narcotics, whether it's dilaudid morphine and hydrocodone or whatever, and they're more prone to do things like that and over consume alcohol, over use like tobacco, or over smoke marijuana. And I'm not saying that to judge, but that does happen, and it can have an effect on your job. If you get a drug test, or if your patient is just so low, you could spaz out on the patient. I've seen it happen so many times. Yeah, so it's a high burnout rate. Another thing that contributes to the high burnout rate is um, you might have some fellow nurses, or you might have some CNAs, or somebody that typically could just be having a bad day, or things are not going, like right at home or something. And sometimes they do bring it to work. And like me, I like to be peaceful at work. I personally don't have any kids, so I like to be peaceful at work and, maintain a certain rapport, level of integrity, and just keep everything like calm and collective um, for the patients, man. And there has been times where it'd be not every CNA is like this. A lot of really good CNAs, but there's have been times where it could be like CNAs or nurses that's having a bad day, or things are not going as optimal at home, and they bring it to the hospital, and then it just creates a really toxic environment, man. And talking about toxic environment, it is a high gossiping profession. I'm a man. I don't see any value in gossiping unless it's constructive criticism, and you would tell that person to their face. But I usually like to stay out of it. But it is a high gossiping environment, and like me being a man, I'm not saying that every woman gossips, but I just think different in regards to conversation than a lot of my coworkers wherever I work. But especially in that field, because typically as men, we just want to come in, do our thing, go home, play a video game, go play basketball, go to the gym, go to Tijuana, go out the country, um, and we don't really care. Well, especially me, like I don't really care to like gossip or make too many friends. It's just a high risk. But yeah, that's that. Another thing about nursing is being a registered nurse. You are the only person in that on the floor that does basically has knowledge of and contributes to, meaning like you do a little bit of the job of every other person in the hospital. The therapist, you do respiratory therapist, you do the inline suction. You got to be aware of oxygen saturation, of what hypercapnia is, respiratory failure, chronic or acute. Um, Physical therapist, you walk the patient, you do a fall risk assessment, you handle the patient with the gait belt. Speech therapist, you observe and determine the diet, whether it's a liquid or soft or minced and moist or whatnot. Occupational therapists, even the doctors, you got to think like a doctor, although you only went to school for like 4 years. Most of the nurses been to school for 4 years, but you got to think like a doctor. The doctor's been to school for 10 or 12 years, but you got to think like a doctor. You got to anticipate certain orders, like if you're unable, because do based on the patient's symptoms, if you're unable to anticipate a doctor's order, it'll affect your value as a nurse, and you'll be looked at more as a liability uh, than a contributing person to the hospital. You gotta be able to quickly assess your like if you see something going on with like this is an example. If you know a patient has like low blood pressure, um, and they have like a lot of pain, and they have a medication that they really need to control the pain because the pain is causing a huge problem on its own, you gotta anticipate that the doctor is going to order like a mitodrin and also like a bolus, for those of you that know what it is. And you gotta, not even just that, you gotta anticipate, you gotta anticipate every different doctor's order. You got cardiologists, you got um, what else? You got hematologists, you got the lung doctor, you got the ears, nose, and throat, and the list goes on. You got to know how the CNAs work because a lot of times you're not going to have a CNA, so you're going to do the CNA work. Um, the list goes on. You do a little bit of infection control. You got to make sure that you're aware of the bacterial, um, the time it takes for those wipes to kill those bacteria. Because if you don't, you could lose your license. You got to be aware of everything you can think. The case management, you got to be aware of where the patient came from, where they might possibly go, a little bit of their insurance because it's going to affect their plan of care and their it's going to affect how like your time frame. There, you got to be really good on time management. um, you basically, there's no other person in the hospital, there's no other hat in the hospital. Those therapists, the physical therapists, occupational therapists, and speech therapists go to school, I want to say maybe like 6 years or something like that, and the doctors like 8 to 11 years. With a yeah, you're there. The therapists are not going to have to worry about what the cardiologist might order or talk to the cardiologist. The CNA is not going to have to worry about putting in an IV. The case management is not going to have to worry about putting in an IV. Or, the doctors don't even put in IVs, and that's not to discredit the value that any of those interdisciplinary titles have, because they have really good, they have really important contributions to the hospital, and more so the patients. But it's just that being a registered nurse, you put on every hat, bro. You gotta have the knowledge and the correct intervention, the correct critical thinking to care for the patients. And if you don't, every day you'll see that you could lose your license, because a patient could lose their life if you don't have that. Not that's considered like the basic knowledge of a registered nurse. You got to understand all of that, because if that patient dies and it's something you could have done as a registered nurse, that's going to fall on you. So a lot of nurses understand that, and it brings like that extra stress, and that's what causes like that burnout. Another thing is like the patient ratio. I don't know if this is necessarily like the doctor or the hospital's fault, because it's a lot of people that can't take the nature of being a nurse, or being a CNA. So there's a lot of turnover rates of people that do get hired, because it's more stressful than it seems. Like, you might see it on paper and see that it's a pay that pays you a little more than what you made when you were like minimum wage. Um, but once you get in it, a lot of people can't stand the fire, so they quit. So then these hospitals uh, put a lot of patients on the nurses and CNAs, like the high patient to nurse ratio. And some could argue that it's not the hospital's fault. That's all that we have. If every hospital has that same problem, it's not necessarily the hospital's fault. It's people that can't handle the career, and you know they don't they don't apply, or they don't keep the job, like they don't show up. And then what does that do? That brings a lot of stress onto the nurses that are already on the floor. Like, if a CNA or another nurse doesn't show up, where do you think those patients are going to get assigned to? They're going to get assigned to who's already there, or the charge nurse. And when the charge nurse is assigned patient, that charge nurse isn't going to be accessible to like the nurses that may need that charge nurse um, as much as they may need them during the shift. So yeah, though that causes a lot of like stress on the nurse, man. Yeah, you gotta be sharp at all times. You gotta be well slept at all times. The shifts are 12 hours. A lot of times you're not going to have time to have a lunch. You're not going to have time to always like use the restroom when you have to use the restroom. And again, these are not the always the hospital's fault. A lot of times the patient's family members are going to not understand, or they're going to be so in the heat of the moment that they're going to expect the nurse to know everything, to fully cure their relative or loved one of their illness or something, and it's like almost like impossible. They're going to want like immediate results. Yeah, and another thing is that the nurse, because you see so many things go on at the hospital, like me, I still work there and I'm still a student. It changes your way that you view life outside of the hospital, because you're so used to seeing people like on vents and like so like messed up from a lot of times things that they could have prevented. So I live a life that's consistent with like not putting harmful things in my body. So when I see people do it in on outside the hospital, I look at it a little different and I act a little different and I isolate a little different, because I understand like people that engage in those things at like 18 or 25 or 30, they could do so, but a lot of those things like catch up to you and catch up to them. And then when you turn 45, you might be um, confused, like your brain could have a lot of ammonia because your liver was damaged due to alcohol associated liver cirrhosis, and now you got to drink a lot of lactulose that's going to help you like defecate uh, that ammonia out to try to get you not confused anymore. And yeah, it just affects how you treat people outside the work. Like your patience is going to be short. You're going to have like road rage a lot of the times. A lot of your family members are going to ask questions to you as if you are a doctor. They're going to expect you to know everything, and if you don't know one thing that a doctor don't know, they're gonna be like, oh, are you supposed to be a nurse, you're in the hospital. Like that's the reality of it. I don't want you guys to get discouraged from anything that I just said. I still would choose, and a lot of people agree with me that chose a lot of these other careers. I still would choose nursing. I wish I would have done it sooner. And if you take care of yourself, of course, and just keep learning, and just take your time on, like having kids. If you do have kids, it's okay. Just be aware. There still are a lot of benefits to becoming a nurse. So I will make videos on the benefits, strictly the benefits. If you have any questions, anything you want to add, please feel free to comment. If you like the video, please like, subscribe for more content. I do content on everything, nursing related, also like relationship, modern versus traditional, controversial videos, but it's all respectful and in the name of love. Yeah, man, I appreciate you guys sticking through the video. If you did, like, comment, and subscribe. And if you don't mind, hit that notification bell to see future vehicles posted as I post it. Thank you guys, and God bless you guys.